few people to join in, but I guess most of the people have joined in. So good evening, everyone. Myself, Garima. I'll be your trainer for medical coding, and it is our class 1, day 1. And I'll start with the brief introduction about myself. I'm being a medical coder. It's been 10 years in this industry, and I'm a physiotherapist turned a medical coder now. And I've started my profession with retrospective coding, and now I'm doing like normal coding with different specialty. I have done in ED, I have done in inpatient, SDC, observation, so ENM. So it's been 10 years in this coding profession for me, and I have also been a part of CDI program run for US hospitals. I've been the part when ICD 9 was taking a major turn to ICD 10 in medical coding. That's a biggest switch in medical coding. So I've been the part of my company being working with Genpact, and I hope everyone is joined now. So let's start with the session. I hope you all are able to see my screen. So let's start with this. What exactly will be there in this session for you people, and what will you learn in this session today? I will take you a brief session about the medical coding. What exactly is medical coding? What is the career opportunity in this? Why medical coding is necessary? Why is it required in this whole healthcare cycle? Where exactly the medical coders lie in this healthcare cycle? Medical coding importance in RCM. Again, when a patient is coming in hospital, and a hospital doctors are giving services and insurance companies are there, then where are the medical coders? Like, what exactly is the role of a medical coder? And I'll give you a brief explanation about the process of medical coding and medical coding classification, and an overview about 2 types of major medical codes used, and a little brief about HIPAA. What is HIPAA? So what is medical coding? Any idea? Anyone? Any hint? What exactly is medical coding? I hope people are from medical background, few are from non-medical background. So what is medical coding? Any? Yes, so you can write in the chat window. No idea what is medical coding? The word itself says medical coding. Anyone? Any knowledge? No answer is the wrong answer. Medical coding is a numeric translator. Okay. Conversion of medical diagnoses and procedure into universal codes. Yes, exactly. Very nice. From the medical report. Yes. So very near to it, and Akhil has stated it very appropriately, very precisely, stating these are the codes that are used universally for the diagnoses and the procedure performed. So if medical is a way to keep coding about like what insurance a patient is applied to, whatever, like billing, etc. Okay. Yes. So is it a question? Akshada, is it a question, or you are saying that medical coding, it can be used for patients or for medical records, whatever insurance the patient is having, doesn't matter? Or is it a question in some way? If medical is way to keep coding. So medical coding is for the entire healthcare. If I'm getting your question right, you just wanted to ask, is it matter like what is the insurance of a patient for a medical coders, for medical coding? Right. Is it your question, Akashta? So So medical coding is being used for all type of healthcare services provided, whether it's in a physician office, whether it is in an inpatient in a hospital, whether it is provided during the in the ambulance. So whatever service is provided and whatever insurance the patient has. So in US it is mandatory to take some insurance. So it can be Aetna insurance, it can be UHG, it can be any insurance. So medical coding is universal. It doesn't matter. Billing is different. So if patient is being seen by physician in a physician office, then the billing is different. Codes are same. Codes are universal. A little bit difference about outpatients and inpatient codes, but overall the codes are same. But the billing is different for office codes and hospital codes. There's little bit of change in the guidelines, but codes are universal. Okay, so let's move it to our slides now. It is a process of transforming description of medical diagnoses and procedures performed by physician or any other healthcare professional or services or equipments into some universal codes that are alphanumeric. So medical coding includes turning your medical or health record into codes so that the code language will be universal to everyone, to physicians, to patient. Not patient is not required, as in to physicians, to insurance companies, the healthcare entity in between, the denial management society. So for everyone, they know, okay, this codes means this diagnosis, this codes means this procedure. So it is a universal language among all the healthcare entities. So codes can be used for the services provided to the patient or the medical diagnoses or any equipment given to the patient. For example, anything like any prosthesis is given, any orthosis is given. So all those things are turned into codes. Okay, this is a brief description. What exactly is coding? Coding is turning your health record into alphanumeric code. So the thing is, the most commonly asked question that I usually encounter: why should we take up a career in medical coding? What is the scope? What is the career opportunity? So right now, if I say healthcare is the primary concern in US, and they take care about it like very seriously. So it is always a blooming industry. US healthcare is always a blooming industry, and there are a lot more opportunities. And if I talk specifically about coding and this medical healthcare industry, they basically outsource most of their work to the countries like India. So there are so many options in coding, and not only coding, there are other adjunct careers with coding like transcription, then coding, then people takes up to CDI program like I did a few years back. So there are many different programs as well. Denial management. So along with coding, for sure, there are other opportunities, career opportunities as well. Any question regarding the career opportunity in coding? What it will be like? So if I talk about South India, they're like in Bangalore, in Pune, there are hell lot of opportunities, and now in North India as well, there's so many companies, the big giants like Wipro, Genpact, UHG, R1. There's so many companies, Infosys. There's so many companies. And why to take up a career in medical coding? What are the advantages for this? First, it is high in demand. Like there's so many, you can find so many medical coders because healthcare is an industry. There will be never a like decrease in fall off for the patient in the hospitals, in physician office. So this is the most demanding and most blooming industry. And if the patient is coming to hospital, if the patient is coming coming to the physician, then of course there will be a medical record generated, and then there will be a need of the coder to code it. So it is a never ending and a never falling career opportunity. Second, it has a flexible work of hours. For example, in coding, it is a profession where it can be a part-time or it can be a full-time opportunity, depends upon you. So in medical coding, there are remote coders as well. There are full-time coders as well. There are people who take up the opportunity with some small companies, or they take up the remote coder program, and they used to code from home only. They take per record charges. Like they basically work for depending upon the records or the charts they code, and they get the payout as per the charts or the records per day they are coding. So you can work from home as well. You can join the full-time career, full-time. You can join a company as well. You can do both as well if your company allows. So uh, that's the second opportunity. Good point being in a medical coding profession. And you have a freedom to work in the multiple settings. Like as I already told you, you can work from anywhere, from office, from home, and there are so many specialty you can work in. You can work in ED because inpatient is the most difficult one. The ladder starts with ED, observation, SDC. On your interest, depending upon how much time you want to devote, depending upon how difficult you want your career, like how difficult level you want to face in coding, and of course the payout will increase in that way as well. Any online classes for medical coding where we can get certified? So there are so many. For example, this class also you will get a very good overview about coding. So I'll cover everything. Of course, practice is the key for cracking the examination, for getting certified. But yes, you have to work, like you have to do the practice assignment. You have to walk through the books. You need to read about the medical terms as well, about the you need to do the sample questions. But overview you will get here about what exactly coding, what all codes, how to derive a code, how to apply a code. So I'll try to cover that, but there are many other online detailed classes as well. Yes, there are so many. Any other question? Have I answered your question, Suresh? Is this course gives us knowledge to get certified for CPC? So Akhil, to get certified for CPC, CPC is an exam in which there are like 150 questions for 4.5 or 5.5 hours, I guess. And it's a detailed examination. For it, I'm telling you, only reading will not work. You need to read, you need to reread, you need to do the self-evaluation, self-reading hours. So it is not I'll not say it is an easy examination, but yes, it is like if you know how to code, if you read the guidelines, if you give a devoted time to it, you will able to certify it. By this course, I will take you an overview about everything, overview about you will be able to derive the ICD codes, you will be able to derive the procedure codes, you will be able to know like to code the scenarios. But yes, guidelines, everything I'll try to cover, but you need to read yourself. Only attending the sessions and then going back, you need to work yourself as well. I'll give you the practice assignments as well to solve to things like that, but you need to work by yourself as well. Any other question regarding the examination, certification, or career opportunity till now? Guidelines, yes, I'll try to. Do you provide material related to CPC? So you can get so many things online as well, but yes, I'll try to provide you the guidelines. There are different guidelines, like ICD-9 has a different diagnosis procedure, has a different guideline. CPT has a different sort of guidelines in terms of what to code with what not to code, what bundles under what. So I'll give you an overview. I'll provide you the guidelines. Not a problem with that. Any other question till now? Okay. Let's move forward then. What are the skills required to be a coder? Only the coding skills work? Only the communication skills work? So you should have a good understanding of computers, because of course you will be using softwares. The examination will be by books, to be clear. I'm not sure now if they have turned it to a software, but I don't think so. Still, the examination is by books only. So for being a coder, for being accepting coding as a profession, you should have some computer skills like Microsoft Word and Excel to jot down the data. And of course, there are some softwares used in coding. That is not a big deal, because whatever company or whatever uh, like whatever facility you will join, they will gonna give you a good training about this. These are the simple softwares, but yes, you should know, you should have a basic knowledge about computers. So the mostly softwares used in coding are CAT, that is computer assisted coding, Epic. Epic is the main software in which the records are uploaded, everything is done. EMR, now everything is electronic. All the records, medical records are electronic, and you will be able to access the electronic medical records from different applications and softwares like Centricity, like Chart Review, and 3M is a software used that helps to walk a code, that helps basically to code. So these are the softwares used. You should have a knowledge about a fair, good understanding about coding guidelines, how to use it, and of course some communication skills. If you need to, there are sometimes there are some query opportunities that we need to ask in a coding profession to the physicians, especially in inpatients. So in inpatient, sometimes communication skill is important, because sometimes we need to post a query to physician asking about the clarity of some diagnosis, asking about some clarity on a procedure. For example, if some repair or suture is performed in skin, and we want to know about its depth, how deep it is. So sometimes we need to post a query to physician. So that's why I've written here the communication skills. But yes, coding skills, of course, that's the foremost and most important one. Any other question? Okay. I have knowledge about CPT and HCPCS. I worked for UAG as clinical investigator for 1.5. Is this course deep knowledge? What? So Akhil, if you have worked, you might. So if you have knowledge about coding guidelines, if you know how to derive a code, then why not? You can crack the exam. Why not? Because to crack a CPC, you should know how to derive a code. You should know the coding guidelines, and you should know, like in CPT, bundling and unbundling. So if you have already worked something like that, you just need to practice a little more. You just need to practice different scenarios, and you will be able to crack. Client verification side. I'm not sure what exactly will be in that, because as I already told you, there are so many fields. If I say in healthcare, in US healthcare, there's so many in RCM. RCM consists of so many small chunks of work and duty. So I'm not sure what exactly is the client verification. But as you said, if you have a fair knowledge about CPTs, HCPCS, I'm not sure about ICDs, then you need to work on ICD. If you don't have, then you'll be able to do it. Yes. Okay. Needs to verify medical procedures and approve, deny as per the codes. Okay. So have you worked with ICD as well? Akhil, have you worked with ICDs as well? So if I talk in general, very little. So you need to work on that, because ICD guidelines are also very important. I guess you have not covered the ICD guidelines there. I will provide you during these sessions, during my classes, I will provide you the ICD guidelines. But to take you through all the guidelines is a very tedious task. So for each and every guideline, it will take a very long time. I will provide you the guideline and give you an overview. You need to read yourself and let me know if you have any problem in any guideline, in any scenario. I will try to cover as much as I can here. Ma'am, can we work as a freelancer after this course, and can I choose this as a full-time employment? Yes, both. You can be a freelancer as well. You can be a full employment, like you can join as a full-time employment as well. If you have fair knowledge, so there are two different things. After this, you want to join some coding company? Yes, for sure you can join, because of course they will also give you a brief understanding about the softwares, the coding thing. So for sure, after this training, you will have a fair knowledge about. You will not be someone with zero knowledge, with nothing knowing about CPTs, whether you are from a medical profession or a non-medical profession. After this course, you will be able to know. When somebody will talk about the codes, how to derive a codes, what codes, you cannot mug up all the codes. There are so many codes. There are thousands of codes. Even I don't remember all the codes. So coding is not about remembering the codes. Coding is remembering about the guidelines. Coding is about, you should know how to derive a code. And even after 10 years, I need to go back to the guidelines and see, okay, what exactly guidelines says. So guidelines are handy with me. So you should have a knowledge. Okay, there's some guideline with this. With time, you will be able to learn few guidelines. You'll be pro in that, because with experience, with learning, with different scenarios. But it doesn't mean that you remember everything. You should have a knowledge that there is something behind this. This code should not be built with this. So it is okay. With experience, with time, you will be a pro. But if you think just after this, no, that will not be the case. You need to work, you need to practice, and you need to devote time. Okay, let's move forward now. Importance of medical coding. As I discussed in starting, that we will cover why exactly is medical coding required in this whole cycle, when patient is coming to physician office, or when the patient is coming to a hospital, and then patient has some insurance. Like patient is in US, almost all the people are insured. So if patient has some insurance, then the insurance company role is there, physician role is there, patient's role is there. Where is the medical coder role? What exactly the medical coder will do? So medical coders are turning the records into codes, and it is a universal language between doctors, hospitals, insurance companies, government agencies, clearing houses, and different healthcare organizations. For example, if I'm a doctor and a patient is coming to my office, for example, and patient has diabetes, and the other patient is coming in who has diabetes, but right now there is some complication because of diabetes. Patient has some gangrene or some neuropathy due to diabetes. So if I'm writing in a record that patient has one patient, that patient has diabetes, for other patient that patient has diabetes with gangrene, so I knew it, being a physician, being a medical knowledge, that patient with diabetes with complication is more complicated. There'll be more. And if I have done some procedure on that, if I have done some debridement, some incision and drainage for the skin, so that claim will be reimbursed with more amount than the previous claim, in which the patient has come only with diabetes. Maybe his or her diabetes has been uncontrolled, or sugar level has increased. So being a physician, might have that knowledge, but how will I convey that knowledge to the insurance companies, that the claim with complication will be like more, there will be more payment for that? So the guidelines being fixed by the government, and the and we are the one who are turning that language out. Okay, the diabetes is E119 and E1140, so the government has fixed it. Okay, E119 with no procedure is this payment, like for this the payment should be this, and if E11.40, it means there is some complication, so the payment should be more. So we are turning into the codes, and government has decided, the agencies has decided its reimbursement, and therefore the payment totally depends upon the coding, how specifically, how accurately we have coded the record. That's why the coder role is very important, because the more appropriately and more specifically you will code the record, the better will be the reimbursement, and better will be the care of the patient as well. So we act as a backbone for the healthcare revenue cycle, ensuring the payers and patient reimburse providers for the service that has been delivered. If physician has done some suturing, like some suture has been applied, depending upon how deep the sutures were, how superficial were the sutures, we will code, and hence the payment will be done. So we are not medical coders are not just crucial for the reimbursement purposes, but also for a high quality care in future visits. For example, if in hospitals there is the records for every and each and every patient, the records are there, like previous, if the previous visit has been done in the same hospital, then they have the records of the patient. If patient this time forgets to tell that he or she has hypertension, then we have the previous records as well, that has the code for hypertension. So this is also important role for medical coding. If the codes are being applied correctly, then of course in future there will be a better and quality care to the patient, because the better we'll capture the diagnoses for the patient, better we'll capture the sickness and illnesses of the patient, the next time the treatment will be given in a better way, of course. If we know the patient has, for example, if there are the charts, there are the records which shows that patient has diabetes, then we know the next time we have the record already and care can be better than the previous one. So this is the importance of medical coder. Any questions till now? Anyone? Any question? How we can search for job? Okay. Once you have a fair knowledge about medical coding, I think each and every company does not require CPC certification as well. I think it is not mandate for everyone to be CPC certified till now. I'm not sure about it, but I guess it is not mandate for each and everyone, depending upon company to company, depending upon their clients' requirements. Some clients say, some US hospital says we want CPC certified coders only. That is increasing day by day, although, but still you can search it like medical coding jobs related to medical coding. Anything else you want to ask, Nihal? Have I answered your question? How we can search for jobs? 11 represent diabetes and no represent. Gautam, can you rephrase your question maybe? So E11.9 represents diabetes. And so don't ask coding question right now. It is very early. Although I can answer, I'm not sure how much you know about coding. So let's answer Gautam's question. Gautam's right. So E11.9 is a code. Oh, you got it. E11.9 is a code for diabetes, and E11.40 is a code for diabetes with neuropathy. So patient has diabetes along with neuropathic complications. So is that your question, Gautam? Making fake jobs are there. Some better way to get jobs. OLX, why are you searching jobs in OLX? Search on Naukri.com, Shine.com, Glassdoor. Like, why OLX? How do we attend live webinar on medical coding for further career opportunity? If you want to, like, there are so many webinars on AAPC site. If you want to attend those, if you're interested, I guess those are the paid ones. But yes, you can go to AAPC site and can attend some webinars. If you will search like on internet as well, some webinar, so I think you will be able to get it. Maybe on LinkedIn or somewhere. AAPC used to organize the webinars on daily basis, on regular basis. So those are paid ones for members or non-members both. For members there will be some less amount, for non-members a little more amount. If you are really interested, you can go for that. I have experience in medical billing. Can I move into coding? Yes, sure, Mavi, you can go into medical coding as well. So medical billing, I think you must have worked with um, processing the claims, if I'm not wrong, forwarding, just clearing the claims, like sending the claims for billing only. But I think you have not worked with diagnosis code, ICDs or CPTs. You need to learn about that, and then of course you can move into coding for sure. Please share details. Okay, I'll share the detail. I will upload that maybe on the site. Suraj Darshan. So have I answered your question? AAPC is the uh, AAPC is the site. You can search on www.aapc.com, and you can generally search on internet like live webinars on coding, upcoming live webinars on coding by AAPC. So you will be able to find that. How much salary you will be getting through coding? It totally depends, Nihal. How much is your experience, in which specialty you want to work with or you are working with. Salary totally varies on your knowledge, on your certification, on your specialty you're choosing, on your experience. So it may vary from something from 4 to 5 lakh to 20 to like 15, 16 or 20. So it totally depends. If you are a E&M coder, you are a radiology coder, you are a lab coder, you are a ED coder, you are an inpatient coder. It totally depends on you. I'm not from medical field. E11.9 two parts, right? E11.9 140. First parts represent the disease, and afterward, yes, Gotham. Yes, you're right. So E11.9, it's a ICD code, and each letter has a different meaning. So initially, it will take you to the main major category of the diagnoses, and later the specificities, the modifiers. I will cover that in the later class. Don't worry about that. I have done BPharma. After BDS, what is the way? Okay. So Nihal, if you have, have you done BDS? Am I getting you right? So after BDS, if you want to go into coding, gather some fair knowledge about coding, codes, what's the role in what exactly medical coder do. If you want to do the certification, try for that as well. And of course, you can try as a fresher in the medical coding companies. You'll be taken as a fresher after BDS because you don't have any hands-on practice about codes. So, but yes, you can do that. This is the only way. Just gather some fair knowledge about coding. So, depending upon in which company you are applying, for what client they are working, they want the CPC certification, or they are okay with someone who does not have the certification. It totally depends. So you can randomly, if you will gather some fair knowledge about coding through my training. Like I'll be uh, I'll be covering all those coding aspects. After that, you can for sure try for different job opportunities in different companies. But that totally depends. For the CPC certification is a different story. You need to see whether the company wants CPC certification or they are okay with it. But for sure, you can apply the coding jobs after this. Mm, any other question, or should I move forward now? I've done basic BSc nursing. I want to work in clinical. I want to work with clinical setup hospital. Can I go for work from home? So work from home, there are so many small companies uh, and companies from US as well. Companies from, like, I have seen people working for US hospitals from as a remote coders. For some US hospitals, they just give their work to smaller companies, and and it doesn't matter for them if they're working from home or from office. They give the opportunity to the employee to work from home as well. So again, it depends upon which company you are trying, whether they have this option or not to let you work from home or not. But there's so many remote coders working from home. Yes, you can join, but uh, how you want to work in a clinical setup, like what exactly does it means? You want to work in clinical setup hospital, you want to work as an inpatient coder, you want to say that? How can we see these work from home job? So Nihal, you can definitely, as I already told you, on the search engines, on the career opportunity sites, you can definitely write US healthcare coding jobs, and then there it asks you the preferences, a full-time job or a part-time job. You can do that. You can apply the filters if you want to work from home only, and then you will be able to see what all companies are giving you the remote coding jobs. But it's my personal opinion, if you are a fresher, if you have no experience in coding, try to work, because nobody will give you a remote coding until unless you are pro in this. You are pro in the sense you have already worked through this, because you will be needing you will be required to do so much of research. If you are from a non-medical background, then of course you need to devote extra hours for that. So I guess in the start of your career in coding, I guess you should work as a like full-time job so that you can learn more, you can learn from other people experiences and then try for a remote thing. This is my personal opinion. So because at least you just if you work with so many people together in the office, there are so many different scenarios coming up, you can discuss, you can train, you can take more training, so that will be a better way to start with. Yes, Afra or Afat, sorry, I'm so sorry. Yes, you can do it as a freelancer, as I already discussed. Okay, let's move forward. Medical coding and billing system. So how medical coding and billing happens? Few people are here in the medical, from the medical billing uh, career and medical billing profession, so I think they can relate to it. First is scheduling. If a patient is there and first patient schedules his or her appointment in the hospital or the physician office, then the registration happens in office or inpatient, and the insurance verification being done, which insurance company, the which insurance patient has. That happens in India as well. Like whenever we go to some hospital or whenever we go to a physician, insurance being checked, so that's the same process. Then the service being delivered by physician, nurses, by physiotherapists, by all the healthcare provider, the service being provided. After that, the record being formed, that's missing here, the record being formed, the records has been will be translated from a handwritten records or the processed records to the electronic medical records, those being uploaded into the systems, and then those records then received by the RCM cycle, by the coders, initially by the data entry people who enters the basic data about patient age, name into a softwares that are basically used for coding, for medical transcription and medical writer. So there are different steps it before the record reaches the medical coders. After that, the codes and the charge being captured from the medical record, and the claim submission being done from the medical coder to the next team, whosoever will submit the claims after the codes being finalized from the coder, then those claim being accepted by the insurance and the payments being done and the payment review. Then again, then there is a payment review system as well, denials being done sometimes, some records being denied and the service being denied, then again the appeal is being done. But basically this is the basic procedure. How what happens when the patient comes into the physician office to the whole circle and the whole cycle, when the patient when the payment being received to the provider, to the hospitals. So again and again the process of medical coding, that means that is somewhere same as I already discussed, the billing system. Accessing what is our job, what exactly we do, what exactly the coders do. So the patient come in, the charting, the data entry being done by the other people, then the claim being submitted by other people, but our job is we access the patient charts, we the medical records being transferred to us in the electronic form through different softwares, and we access those softwares. Our basic core job is to access those softwares where we can find out and access. We know, okay, this patient has come, this is a chart number, how to access those charts. Then if some codes are applied, then to verify those codes and apply the CPTs and ICD codes depending upon the patient's visit. Is it a emergency department visit, is it an inpatient visit? Then the quality check being done and the submission of the coded charts. So this is the core job of a medical coder. Any questions? I need to go to the chat window to see the questions again. Is there any short certified course? Anjana, what do you mean by short? What exactly is the short? I'm not able to get your question. Short certified course. I guess CPC is the only course that is valid. If any company is saying, is there any other course, CPC, CCS, inpatient, there's a different CPCP. So these are the only courses that certifications that are required, certified course. Other course, I think they are not valid. If they're not valid. How to search work for home job. Okay, that's been done. How to search. Mahavir, I have already covered this. How to search for work from home job. So I have already told you, if you have a knowledge about coding, just figure it out that you want to work with US healthcare work, maybe as a medical coder in US healthcare, and then you can filter out whether you want a part-time job, whether you want a full-time job. So you can search by that way. Okay. So again and again, I'm saying a provider, a payer. Who is a provider and who is a payer? Anyone? Anyone knows what is a payer, what is a provider? I'm again and again saying these two terms. Who are providers? Yes, providers are doctors. Any healthcare, or instead I'll say, Akhil, you are very right stating that providers are doctors, but doctors, not only doctors, healthcare professionals, I'll say. So that can include the nurses. So all those healthcare people, yes. And who are the payers? Anyone? Payers are the insurance companies, definitely. So, yes, any insurance company. So, basically, the two types of people, there are two types of work being there. First, you can work for the hospitals. So, there are different companies who has the work from provider side. There are companies who has the work from payer side. For example, UHG8, now these are the insurance companies, these are the payers. So they have like, you need to work there from the opposite side. You need to work so that you can verify the claims. You can verify whether the charting has been done properly, whether the claims that has been asked, the codes that has been asked, that are correct or not. Because you are working for the payer. You are there for payments. And if you're working from a provider side, it means you're working for hospitals, you're working for doctors, you're working for healthcare professionals. So if you are if you join some company who has a provider work, it means they're working for some hospitals, and you need to code the record so that you can ask the insurance companies for claims to get cleared. So that's why we should have a knowledge what are the providers and what are the payers. Okay, I'm sorry for this. So provider, what is the work for provider? Provider again means doctors, means healthcare professionals. They need to prepare a standardized bill for the services given to the patient. That's why the coding is required from provider side, because they need to prepare and generate a bill. Second, uh, why coding is required from payer side? To determine the amount to be paid to the provider. If you are working from a payer side, then you need to decide, you need medical coders, so that they can verify whether the amount being claimed, whether the codes being claimed are correct, so that, because they need to do the payment. These are the two sides of medical coding, being working from a payer or a provider side. What are the medical coding steps? So medical coding steps, first and foremost, access the medical records from the software, and then verify and determine the patient. Who is the patient? Who is the provider? What is the place of service? Why is it important to find out the place and date of service? Any idea, anyone? If we are doing a medical coding, so first we access the records, we open the records, and then we just determine who is the patient, who is the provider. But why do we require this place and date of service? Where the, like, why do we need that? We just need to see the diagnosis, the illness, and the procedure performed. What is the role of, why do we need to see on which date the things are like the service being provided, where the service being provided? Any idea, anyone? Yes, Akhil, very appropriate. And why do we need, why we need to know that, whether it is an inpatient, outpatient, ASC? Why do we need to know that? Anyone, anyone else who has any fair knowledge about big questions, and no answer is a wrong answer. Any try? For different facilities, we have different codes. Very nice. We'll get to know about severity of disease. Severity of disease, you will be able to know from the sicknesses and illnesses written in the medical record. I am asking about why we need place and date of service. So first, place of service, as Akhil said, you need to require the place of service to know where exactly the service being provided. It's being provided in a physician office or inpatient or OT, depending upon that. Why we need to know the date of service? Date of service is required because you need to jot down each and every incident in your application. For example, if two procedures being done, one is suturing a laceration being done, other is maybe a cast being applied, and if two services are being done on a different dates, then you need to capture it. Okay, on this date this has been done, on this date this has been done, to capture the charges. Also, the date of service is required because sometimes some services are included, are being the part of other services if being done on the same day. So that's why the date of service is required, to know whether it bundles with other service, whether we need not to report it. If it's being performed on a different date by a different physician, then it's being reported. So you will gotta know about it. It's a major role for the place and date of service of both. Uh, Insurance calculation, yes, maybe you're right, Nihal. To get the maximum reimbursement. So the term maximum reimbursement is wrong in coding, I'll say, as my experience. Maximum reimbursement is wrong. Appropriate reimbursement is correct word to say. So we need to code the record to the maximum specificity. Maximum reimbursement should not be the right word. It depends. If you have, you should derive the codes to the maximum specificity, to the maximum accuracy, and then reimbursement depend on that. Case history recording. Yes, exactly, because you need to do that. Sometimes you need to check the data entry as well. For the case history recording, you need to know the place of service and the date of service as well. For medical legal purpose, yes, very right. And for unbundling, we need all those. Place and date makes easier to pinpoint the service. Everything is right. Yes, you all are right stating that. Let's move forward on our next. So I've covered this. Oh no. So the third step in this is abstract the diagnosis code with complete accuracy and specificity. As I already said, reimbursement, if you will make your mind, for example, this happens in inpatient coding. If you make your mind, okay, I need to code it for the maximum reimbursement, and you just forget to follow the guidelines, then you will be wrong and you will get the denials. You need to code it appropriately so that the codes will specify each and everything. Codes will give the picture of patient illness and procedure profile very elaboratively, very clearly. And the fourth step is to abstract the procedure codes, to abstract the services being provided by the physician, whether it is some intubation being done, some sutures being done, some injections being given, some infusions being given, whatever. And then verify all the codes, do the sequencing, and then send the claim for billing. These are the medical coding steps. Next, what are the types of medical codes? So primarily, there are two types of medical codes. One are the ICDs that are majorly used, and second is the CPTs. ICDs are International Classification of Disease, which corresponds to patient's injury or sicknesses. And what are CPTs? CPTs are current procedure terminologies which relate to what functions and services provider performed on or for the patient. So this is the major chunk that's being used during codes, but I'll say these are not the only ones. ICD and CPTs, there are HCPCS as well that are being used, but major chunk, yes, ICDs and CPTs, you should have a good knowledge about these two. For example, in a one medical record, there can be multiple diagnoses. If I say that codes need to apply to some medical record, it doesn't mean that, like, there can be n number of codes. There can be 10 diagnoses code. There can be one procedure code. There can be 0 procedure code and 10 diagnosis codes. So it totally depends upon the record how many diagnoses are required to capture the complete picture of patient, and how many procedures codes are required to capture the complete picture of the patient. I have mentioned here a few examples to give an overview about what are the diagnoses and what are the procedure codes, CPT codes. For example, J18.9, it is a code being used for pneumonia, and I10, it is a code being used for hypertension. Procedure code like 96372, it is a code being used, a CPT code being used for injection, and 44970, it is a CPT code being used for appendectomy. Appendectomy means removal of appendix if some surgery being performed. So let's move to the next slide about the diagnosis code. Guys, any question till now? Also, you need to learn about the medical terminologies. You need to keep your Google on, whether you are from a medical profile, whether you are from a non-medical background, because there are some terms you need to search what exactly the term is, because before coding it, you should have a knowledge about it. If I say cholecystectomy and you don't know what exactly is, so even now, being so many years in coding, sometimes there are some abbreviations being used in medical records, because doctor languages, doctor abbreviations, we cannot. I am from a medical background only, but sometimes some abbreviations are completely different. So I need to search those abbreviations, what exactly the abbreviation is. So you need to keep your Google, or you need to do a lot more research for the words you're not getting, or the different meanings. So if you want to code appropriately, if you want to, capture the correct code. Process code. What is process code? I'm not getting you, Gautam. Can you rephrase your question? So, anyone, any other question? Okay. By the time he's writing the question, previous slide in the box. Okay. Let me move to the previous slide. Procedure code. You want to ask about procedure code, Gautam? Okay. So procedure codes are basically for the services. So there are two things. For example, I am a patient and I go to a doctor and say I'm having a shortness of breath, I'm having chest pain, I'm feeling uneasy, and there might be 2-3 things in a what will my medical record look like? Initially, there will be my chief complaint. Patient is saying the patient has shortness of breath, patient has chest pain. So these were like symptoms and chief complaint. And then physician write his or her diagnoses that, okay, patient has, for example, patient has bronchitis. So that is diagnosis. And we will code to those to the diagnosis code. And then the treatment will happen. The physician might give me some injection for bronchodilate, or some bronchodilator, some tablet, something like that, some injection being given to me. That will be a procedure. So procedure codes are the services being provided by a physician. One is the diagnosis, what illness, what sickness, what is the problem to the patient. Second is the procedure code, what services the physician is doing, whether he is giving some injection, whether he is doing some surgery, whether he is giving some oxygen to the patient. So those are the procedure codes, how we will capture them. Okay. Okay, let's move forward. Diagnosis code. So ICD stands for International Classification of Disease. So initially there were ICD-9, now there is ICD-10. ICD-10 codes are used for all the diagnosis codes. Previous version was ICD-9, as I told you, that was used till October 15, 2015. So any billing, any record before that, you will find ICD-9 codes in those records. After that, if anything Any patient being discharged after this October 15, 2015, in those records, you will see only the billing will happen if ICD-10 CM is being applied. So ICD-10 CM being applied, being used since October 15, 2015. It's a new revision being done. We will read in detail about it. ICD-9 CM and ICD-10 CM. So, what is the basic? What exactly is this? Why ICD-9 and why ICD-10? Why it is required? Because you cannot imagine there is such a mess when the things are being turning. There's so many times it's being postponed to for the newer version. It's being postponed because it is a very difficult process to change the entire system, the entire coding thing. It was a very big change for everyone, for the coders, for the payers, for the hospitals, for everyone. So why it is required? Anyone? Why do we need to change it if it requires so much of it? It disturbs the whole industry so much. Why the revision is required? And for the CPTs as well, for all the coding guidelines, everything, there's a revision every October. There's some change in guidelines, something happens depending upon the feedback, depending upon if there's some glitch during like if there's some glitch while coding, some gap while coding. And so revisions usually happens in a year, a quarterly, every quarterly, like there are four or three revision and major revision being done in October. But this ICD-9 to ICD-10 change, it was the major change in coding. Anyone, any fair idea why we required this 9 to 10 conversion? New diseases, yes. So what I am saying, there is every year changes, every quarter changes. Those changes are because sometimes, for example, now the COVID has come. It is entirely new disease. So in June only, before June, we were using very vague code, quite a vague code. Then the change being done, a temporary code being given to use in the COVID. And now there are so much explanatory. There are so many explanatory codes for the COVID. So for new diseases and new procedure, the revision happens like every quarter, every year. But this ICD-9 to 10, this revision was done because there are so many gaps in ICD-9. ICD-9 system, the codes were lacking the specificity. In ICD-10, it is such a detailed version of coding system that sometimes when I talk about ICD-9, some code when we used to apply some code in medical record, it did not give any like complete specificity about a code. But ICD-10, it is very explanatory, it is very specific. That is why this change is required for being more specific, detailed, accurate. That's why this change is required, because more accurate the record will be, more accurate the payments will be, more quality of care will be provided to the patients. That's why this conversion, this huge change is required. For advancement in surgeries, yes, Arafat. So advancement, as you say, as I already explained, these changes generally happens whenever so first the trial code is there for any new changes in procedures. If you say first the trial code is there, and then that will be converted to a permanent code. So this happens regularly. But this was a very different change. If I talk about ICD-9 to 10, this was a very different change. Okay. What exactly was, just a brief overview, what exactly was ICD-9 and what is ICD-10? In ICD-9, there were only 13,000 codes, and there are so many codes that says, for example, that says pneumonia non-specified. Just an example. So there are so many non-specified and other codes were used. So that does not explain the disease completely. But ICD-10, there's so many varieties of codes. So if there's one disease, you can explain that disease in 10 different ways. If there are 10 different possibilities to classify and to define that disease, then ICD-10 has that. That is why it is required. And still, so many codes are coming up every single time the updation occurs. So that is a major difference. ICD-10 implementation date, as I already told you, was October 1st, 2015. ICD-10 eliminated any vague codes, any non-specified codes, and that helps the reimbursement process. And there are some combination codes for symptoms and diagnoses, and a fewer code needed to report. So in ICD-10 now, in ICD-9, sometimes we need to capture four codes for a patient that will capture the complete picture. But in ICD-10, some fewer codes are required now to capture the complete picture of the patient. So that is the change. That is the specificity in ICD-10 now. What is the difference between ICD-9 and ICD-10? I just captured here a little bit of comparison between among 10 and 9. So if I talk about procedure codes, there were 3,824 codes, and now in ICD-10 there was 71,924 sets. So I'm talking about here ICD-9-CM and ICD-9-PCS. Then diagnoses, there were 14,025 and now 69,823 codes. What is the old structure? I'll show you this first. So this was the old ICD-9 format and this is the new ICD-10 format. In ICD-9, initial 3, as somebody asked me in the chat box, what exactly is E11? So this is the category code. We know it is the code related to diabetes. So initially in ICD-9, there was a category code, and then there was there are three initial 3 alphabets, initial 3 letters, 3 digits are being used for explaining the category, and then the last 2 explain the etiology, anatomic site, and manifestation. However, in ICD-10 now, the code is being lengthened. Codes are more detailed, as I already told you. The initial 3 digits again explain the category only, and the last 4 digits combines the etiology, anatomic site, the severity, and the extension. The initial 3 explains what is the etiology of this, what is the anatomical site of this, and the last digit explains the extension. I'll give you the example here. When the transition happened to ICD-9 recertification, so when we were doing, there were so many trainings for ICD-9 to ICD-10 where we need to, we need to do so many trainings, so many courses to learn. That company only provided us because the clients were the same. Our clients were same, so they have conducted those trainings. So it is not required. That was not required. Trainings were conducted, assessments were conducted. That is how the certification being changed. So if I take an example of ICD-10 here, how ICD-10 is different. Can you see the code on the top left hand side stating S52.311A? So ICDs are alphanumeric, if you can see, starting from a alphabet and mix of numbers and alphabets. So the first thing, it is a 7 characters. There are 7 characters in a ICD. The first character, if we talk about, the first 3 characters specifies the root, specifies the category of the code. In the previous slide, you remember, just see on the right hand side the ICD-10 CM code format. The initial 3 explains the category. The next 3 explains its etiology, anatomic site. How? If there's a code stating S52, what does S52 mean? S codes are the codes from injury and poisoning and other consequences, external causes from this category. So S explains that it is an injury code. 5 explains injury to elbow and forearm, the specificity to it, the site to it. The 2 explains what exactly is the injury. For example, if it is a fracture, so what is the injury? If it is a laceration, then there might be something else instead of 2. Then the site explains the site. You can say, okay, we have already captured the fracture of forearm. Why we need to capture this 3 site? So this is the specificity in ICD-10-CM. It specifically explained that in forearm, which bone is affected, which bone and which side is affected. So if there are two bones in arm, radial and the ulnar, so which bone is affected? The radial bone is affected. So that captures the side. Then the severity, what sort of fracture it is, how deep it is. Etiology is written right, it is written wrong, not it is not the etiology, it is the right hand side, which arm is being fractured. So laterality, I will say. So it captures the right arm being affected and the extension being which encounter it is. The patient is coming for the first time. So you can see how explanatory the code is. You will be able to know which arm is being affected, what exactly is the injury. Injury is a laceration, just a cut or a fracture, on which bone, on which side, on which, what is the encounter of the patient. Is the patient coming for the second time for the cast, or the patient is coming for the first time? So you can, the code is self-explanatory. That's how the detailing is there in ICD-10 now. Any question? Okay, no questions. Let's move forward. So let's go through the structure change. As I told you, ICD-9 was 3 to 5 characters, and ICD-10 is 3 to 7 now. First character is numeric or alpha. First character is alpha and second character is numeric in ICD-10. 2 to 5 are numeric in this, 3 to 7 being an alpha or numeric. You need not to remember all this. It is just for your knowledge. You should know when you see a code, you should know, okay, this is the ICD-9. So that's why I have jotted it down. Like, you should have a fair knowledge about it after seeing the code. Okay, it is ICD-10 code, and you guys will be dealing with ICD-10 only. But being a coder, you should know, being in a coding industry, you should know what exactly is 9 and 10, why there is a difference, what exactly is this, why it is required. That's why I have I captured this slide. And procedure structure being changed, like initially the procedure being captured with 3 or 4 characters, and in ICD-10 PCS there are 7 characters. In ICD-9 there were 3, like all codes have at least 3 characters, and in this it can be alpha. In ICD-10 it can be alpha or numeric. So numbers are starting in ICD-10 PCS. PCS is for procedure coding. So ICD-10 PCS is completely different from CPT, as I already told you. CPTs are being used for outpatient services, for hospital, for office services, and ICD-10 PCS is only used in inpatient record. So while coding the inpatient record, you need to capture the procedures by ICD-10 PCS. We will study that. And for office and outpatients, you need to capture the procedures by CPT procedure codes. Okay. So let's move forward. What are the procedure codes? Can anybody revise it? Can anybody again explain me the difference between CPT and ICD-10 PCS? We already have CPT codes, then why do we need ICD-10 PCS? What does it mean? Anyone, any guesses? Come on, guys. Try maybe. Whatever you know. Nothing is wrong. I just covered it. Why there are two different types of procedure? So there is one diagnosis coding, there is one procedure coding. But why there are two types of CPT codes as well that captures the procedure, and ICD-10 PCS as well that captures the procedure? So guys, anyone? No? So I just explained you CPT codes. CPT is current procedural terminology. CPT4 codes that are being used for the procedure provided, for the services being provided by the physician, but that are mostly used for the physician services in the outpatients, in emergency department. So ICD-10 PCS are only used for hospital billing. When the patient being admitted to a hospital, then the procedure is being captured with this ICD-10 PCS. That is the difference. Yes. Yes, Gunjan. So the federal government established the Healthcare Common Procedural Coding System, and we used to HCPCS. We used to call this HCPCS, HCPCS, and it was established in 1978. So the big umbrella that covers the procedure codes in coding is by HCPCS, but it is divided into two different levels. First is the level 1 codes, second is the level 2 codes. What are level 1 codes? Level 1 are the CPT codes that are being explained as current procedural terminology codes. These are the 5-digit codes. If you remember, I have given you example here in this sheet. Can you see on the right hand side the procedure code? How many digits are there? These are basically the 5 digits code. 96372 44970 12001. So CPTs, you can see these are the numeric codes. All the numbers will be there, and they are basically 5-digit codes that explains any procedure, any service, any surgery, injection, infusion, cast, any ORIF. ORIF is any, for example, implantation being done, knee has been replaced, lamina, appendix has been removed. So anything, any surgery, any procedure being covered with these CPT procedures. And who maintains this? Who basically brings in the change for all these codes? Who updates this? So basically, these are maintained by AMA, that is American Medical Association. Procedure codes medical billing is most concerned with on CMS 15 claims for physician service. So CMS 1500 is the we used to call it HICFA. So this is the basically a medical billing form, you can say. On this, the CPT being used. If we talk about level 2 codes, so the procedure being covered with the CPT codes. But what about the non-physician services? We will capture those non-physician services that are not covered by CPT 4 codes by the level 2 codes that are basically called the HCPCS codes. And these are composed of a single letter. So these are 5 digits again, but it is alphanumeric. So there will be one alphabet and then followed by 4 digits. For example, G111003. This is a HCPCS code. Okay. So level 2 codes are other than this. For what are these codes used for? If we have already explained that all the services being provided are captured by level 1 or CPT codes, then what is the requirement of the level 2 codes? So these codes are required for any services, any ambulance service, for example, ambulance being used, for example, any prosthesis device being uh, provided to the patient, how to capture that, any supplies being given to the patient, how to capture that. So those things being captured with the level 2 HCPCS codes. Okay. Any question? Are you clear with level 1 and level 2 codes? Anyone can give me an example of some HCPCS code? Like what can be the service? Orthosis, prosthesis, anything else? Anything else, guys? So if, for example, any stimulate, no, labs are not, labs will be covered in the CPTs only. There will be different CPTs starting from 8 series for labs. Okay. Let me explain again. So procedures can be two ways. One, the physician services. For example, let's start this way. For example, some patients comes in with a knee pain and patient has some osteoarthritis of knee, where the bone degeneration being done, so the bone has been worn out. Physician has decided to replace the knee joint. So what do you think? How many codes will be applied? Anyone? To capture all the codes. If patient came in and says I have a knee pain and physician writes, okay, you have, I'm sure there'll be some non-medical people, so please don't afraid if I'm using some like difficult terminologies like osteoarthritis or degenerative. So don't, it is okay to not know these terms. We can always Google, and with time you'll be able to get these terminologies. But basically, if physician writes some diagnoses and say and done some procedure like knee replacement, so the major codes that are being used is first osteoarthritis knee. All other things, the knee pain, etc., will be inside this code. So first will be the osteoarthritis knee. Second, the surgery code. The physician, whatever services the physician has provided in changing the knee. So knee replacement includes changing patient's knee joint with a artificial joint. So okay, physician services being covered with a with a CPT code. But what about the payment for the prosthesis? What about the prosthesis that is being used inside the knee joint? How the hospital will gonna get that, the reimbursement for that? Because the prosthesis is being used, that is being implanted inside the knee. So three codes will be required. First is the ICD 9CM. Second will be the level 1 code, the CPT code, the physician's efforts in changing knee. And the third will be the level 2 codes that will require the prosthetic code, the code for the prosthesis that is being used. Okay. ENM, yeah. So Akhil, ENM again, it will depend. That is the first visit or the second visit. That is again a different story. If the bigger procedure being done, the smaller procedure being included. So that is a different story. That will be detailed. Again, that will be a part of a guideline, the detail about how to code. But for the beginners, that's why I'm just capturing this. Why, to explain why level 2 codes are required. Just an example. Is it clear, guys? Any other questions still? Why? What are level 1? What are level 2? What are ICD 10 PCS? What is ICD 10 9? Any other question? Is it getting too much for the first class? Okay, guys. Let's see example. Let's see example. What exactly? How will you code a condition like? So, if a patient comes in with a broken leg, how will you capture the code? What do you think? Let me not show you the slide. If the patients come in with I have already covered an example about the ICD 9 code previously for the fracture. But generally, if we think about a scenario, if the patient came in with a leg fracture, what do you think? What we need to see in the medical record to capture the codes? Start writing in the chat box, whatever things anyone thinks. If the patients came in, okay, my leg is paining, I think patient met with some accident, okay, for example. Any guesses, like whatever wild guesses you have, what all you need to see in the medical record to capture a code? What is important? Come on, guys. While being a coder, what do you think? What part of medical record is important? So Manoranjan, what exactly you wanted to say? To what document you are looking for? Which which place you having pain? Okay. Examination. Okay. Fracture, plaster cast. Okay. What else? So let's go step by step. First, patient must be having some chief complaint. I'm having leg pain. There's some bleeding. There might be some cut in the leg, something like that. There might be some abrasions. Abrasions means a scratch in the skin, maybe. What do you expect in the medical record? What will be there? The patient name is written, patient age is written, physician name is there, patient number is there. What will be there in a record, medical record, guys? Demographic, yes. So what is demographic data? Anyone else? What is demographic data? Yes, Akhil. Demographic is basically the details of a data, the age, gender, name of the patient, marital status. Okay. Yes, yes, you're right. So, I'll be sharing now because I am new to this, and sure, Manoranjan, I'll do that. I'll do that. Occupation income, okay, but that's not important for us. What else? Okay, name, age, location, difficulty the patient is facing, physical appearance of injury part. Yes. Now, medical record has so many things, but I have given you a very simple example. What do you think? I am asking you because I have already covered one example of fracture. What do you think while coding? Let's start with ICD-9 code, okay? We want to capture the diagnosis, the fracture. Okay. Yes, Akshada, you're right. We need to capture in medical coding the past medical problems as well, but with some guidelines. What problems to capture, what not to capture, that is again and under comes into our guidelines. Because there's so many things on a medical record, so many things. For example, if there's some surgery being performed 5 years back, that will be there in the past medical surgical history. Is that important? Is that not important? So that will that we will cover under the guidelines. But I'm asking you a very general subjective data and objective data. So guys, now talking about ICD, I want to capture the fracture code. Let's not talk about the CPT now, CPT or procedure codes. If I want to capture that the patient has fracture, what I need to see to capture a code? What do you think? How specific it, like what specificity being required? Type of fracture, site of fracture, age not required while capturing the fracture. Yes, we might need it for some other problems, but for capturing the fracture code, age, it is not there in the code description. So which leg and type of fracture exactly? So is it a left leg or a right leg? Which bone is fractured? Site size communication. So yes, you all are right stating that. So let me show you the previous example. Do you remember this? So if I want to capture a code, a fracture code, we need to know which leg is injured. Is it a left leg or a right leg? Which part is injured? You need to see. Is there a fracture at thigh or at lower leg or at foot? Because the leg is a whole leg, na? So while coding this ICD-10-CM, it will ask you, okay, in leg, now which part? Upper leg, thigh, then the bone, which bone? So you need to see the radiology records as well. The x-rays being performed, the physician, most of the time physician used to write which bone is fractured, on bone as well, which part of the bone. For example, if it's being written that femur is fractured, femur is the thigh bone. So from where the femur being fractured, from the upper end, from the lower end, from the mid end. So that is also very important to capture. So it depends. So your quality will totally depend, your quality of work will totally depend how much specificity you have captured. For example, if the record states that the thigh bone being fractured and you have captured a random code that says fracture of right leg femur bone unspecified, that is also right. But if somebody has captured and find out in the record that it's being written that right femur fracture upper end, so that is more specific. So the more specific you are, explanation of the diagnosis or the disease you have captured, the better. Like, the quality depends, the how we judge someone, how we can say the quality work and average work. So more specific and more accurate you are, better will be the reimbursement. There will be no denials, there will be no escalations from the client. So you need to first you need to research the things you are not getting from the record from Google. Second, you should be thorough about ICD 9, 10 ICD 10 guidelines and CPT guidelines, bundling and bundling. And for the next is, you should be able to look into the record. You should be good while during analysis, during researching. You should not skip something. Okay. So I see in this case scenario, when the patient came in with a broken leg, let's see what all is important. The associated visit is an initial or a subsequent visit. So if we want to capture a E&M service, for example, if you go to some physician, then and physician does some procedure. For example, physician applies a cast to you. So physician asks for, like, there will be the two payments that you will be doing. First, the consultation fee, and second, the application of the cast, right? So in this as well, in coding, when you are visiting a physician, there are E&M codes. We will cover this while once we will start the explanatory layout about ICD 9 codes or the CPT codes. So the first thing, you should know the visit. What is the visit type? Is it an initial visit? The patient is coming for the first time, or the patient is coming for the second time? So in fracture as well, the patient can come to the physician for the second time. I had a fracture like 4 days back and I got a cast. But again, today I want to go to the physician and just want to recheck or to change the cast, or I'm feeling pain at the same site. So this is also important to know how the physician will charge the consultation. So there's a different reimbursement for different consultation. Is it the follow-up consultation? Is it the first consultation? First is that you will look out. Second is the specific bone of leg that is being injured. You should know the specificity, which leg is being injured, left or right, but then again the specific bone that is being injured. Then while coding the fracture as well, you should see and figure out the detail whether it is a closed fracture or a open fracture, because that is also, when you will be walking walking the code in book, then there will be two options. Is it an open fracture or a closed fracture? You need to see that as well, that the bone is that the area where the fracture is has happened, that is open, or the skin is not torn, that's a closed fracture. Is fracture a traumatic or pathologic? Fracture being done by some trauma, some accident, or there is some disease patient is having. For example, the cancer patients, their bones get so weak, sometimes they have fracture due to that. So there's so many things. Guys, trust me, my idea behind explaining you this is not to scare you guys that how much detailing we required, but to just explain you that it will require a detailed analysis, and of course with practice you need to do like a lot of practice for that. Okay, so I have written the spelling here. It's HIPAA. This is the last thing we'll be covering today. HIPAA. So what is HIPAA and why we are reading about it? HIPAA is basically an act being formed so that the privacy and personal information of the patient is being protected. So it's called Health Insurance Portability and Accountability Act of 1996, and the term is frequently used to mean many regulations which has been published since 1996. So it is an act that states for anyone who is accessing the records, the medical records, whether uh, those are the data entry people, those are the medical coders, those are the medical transcriptions, medical writers, CDI people, anyone, they have to go through this HIPAA training. Why does why USS, why AMA and CMS has released this? Why it is required? Because they are very careful. They're very concerned about the patient's personal health information. They want to protect the PHI. So everyone who has the access of the personal health information of patients, they have to go through this HIPAA training. Don't worry about that. Whenever you will be working with any company or any association or organization, they will get you through this. Um, they will before starting anything, they will guide you what exactly is HIPAA, how to do it. I am giving you this information so that being a coder, you should know what is HIPAA. You should know what it stands for, what exactly it includes. So HIPAA insists that any organization that stores or transmit the patient's information must take wide steps to adhere to HIPAA sweeping privacy, security, and transaction standards. HIPAA requires healthcare entities to ensure they protect the personal health information and privacy rights of patients. This is basically an act being formed so that so that a confidentiality agreement is there, that okay, if we are accessing the patient's records, then we are keeping this information to us, so that there is a no leak of information. So guys, for example, if anyone is working with accounting or banking team, and if someone has information about the some like about the clients with their bank details, so it is stated that there should be no breach in policy. There should be no breach while leaking any of the personal information of the clients. So this is a guideline being generated so that there is no breach, there is no leakage of any sort of health information of patients. And US is very US healthcare, they are very rigid and very careful about any information about patients. So how do we protect it? Almost every organization and every company has these guidelines, because this is the mandatory law to undergo this training. So it is a confidentiality agreement, the term that states not to use, publish, or disclose or permit others to use any confidential information they come in contact with. Because guys, not only medical coder, as I already said, if you are accessing the patient records, then there will be so many personal information. Maybe my age, my gender is important to me. Maybe my age is important to me. My address, my SSN number. Maybe if some patient has cancer, he or she doesn't want anyone else to know this. So it is very important to know what records we are dealing with, how important the informations are. So uh, you will see in most of the coding companies there is a paperless environment. Most of the clients says, and HIPAA says, the environment should be paperless, because they don't want any information to be written anywhere, to be leaked anywhere. So that is one. Access card and biometric, so that no one can come into the facility without known without any unknown identity or anything like that. The people who has given the permission by the clients, only those can access the documents, only those can access the floors, access to the critical areas like server rooms and anything like that, that is being. So HIPAA basically says there should be no breach. There should no, like, only the people who are allowed to see the records, to see the documentation, they should only be permitted on the floor. They should only see the records, and they should also not disclose the information to anyone. So this is HIPAA. That is it, guys, for today. Now, any questions about anything? Today I have taken a brief about everything, but yes, it is just the start. So there's so much of detail about ICDs, CPTs, HICPAs, the billing procedures. There's so many things. So please don't get afraid. It is just the start. and we will cover everything in as much detail as I can in all in the upcoming sessions. Now I want you guys to please ask me whatever questions you have. Thank you, Gautam. Thank you. Mm, I have understand it well, but just want to ask, will you help furthermore for this? Uh, so Akashda, yes, for sure I'll help furthermore. Furthermore for this as well. So I have just covered the brief overview about ICDs and CPTs. Trust me, this is not even the start. The, I have given you a very brief overview about what we will gonna read in the future classes. There's a lot about it. There's a lot about it. But guys, trust me, you need to read yourself as well. Thank you, Anjana. You need to read yourself as well. Only my classes will not gonna help you. Once you go through the session, go and read yourself, try and pull out some scenarios, bring in some questions, practice yourself. Only then I will say, it will help you. Practice will help me, I guess. What should I learn now? Like the codes, are they available? Everything is, so there's so many things available on internet. You can read about the billing procedures, how the billing is being done. You can read about so guys, I'll go step by step now. I have covered everything in a very superficial way today. So I'll be covering how the forms look like, the billing forms, how the medical records look like, and I'll try. So today, let me show you this thing. That's why I've not closed this. I tried to find out this PDF for guys. This is a book. If people are here who want to clear the CPC examination, guys, you need to take your book there, I guess. And this is just the PDF. This is ICD I have pulled out today. This is how the books look like. So ICD is the diagnosis code. This is disease and injury. So these are the table of contents. Like these are the diseases. Like first is the infectious one, then the neoplasm. Every disease has a different category codes with different, sets. For example, A codes to this codes are an infection, E codes are this. So that's how the book looks like. That's how the codes look like. The one, for example, if I just pulled this PDF out to give you an overview how book look like, how the codes are there, and how we pull out the codes. So this is code. For example, let me go to the diabetes. Maybe that will help you. No. So musculoskeleton is a different one. Guys, you need to learn two types of things. First, little bit of anatomy, sometimes little bit of medical terminologies, whatever you encounter. Okay, let me Google this. What is this? And coding for sure. These two things you need to work upon because both are required. It is not mandatory that if you are from a non-medical background, you cannot do it. No, you can do it. But you need to work a little more extra. You need to research a little more extra. For example, if I'm a medical background, I know what is synovium. You can work out the code, but I'll suggest in the your initial 1 year, your initial 6 months of the coding job, try and search out, being more curious. Okay, let me search out what is this? What is this? Not in a deep, maybe. Let me search out what is synovium so that you know synovium is in the joint. Okay, joint disease. You need to code the joint disease now. Initial few months, the better you research, the better you work, understanding your concepts will be clear with that. Okay. You read yourself means how should I get the study material? Guys, read yourself means, for example, if today I have covered, this is the overview, these are the ICD 9, these are the ICD 10, try and pull out some online books like ICD, for example, like I have shown you, and just look at it. What exactly, take a feel of it, how the books look like, how the codes look like, take a feel of it. whatever sessions I'll take, try and go through those sessions again, and then find out, okay, this is the thing you couldn't find, you want to know more, search search that on internet, try to find out some case scenarios like that. Of course, it is very early to do that, but whatever session I cover, try to figure out things, try to reread that, try to building your concepts behind that. Are you presenting any new? Because I can't see the book. You cannot see the book? I'm almost not able to. Okay, let me see. Let me see, guys. I'm sorry. I'm sorry, guys. Let me again share. Guys, can you see now? I am sorry for that. I didn't see the chat window. No? Okay. Guys, can you see now? Gotham can see it. Okay. I guess I've shared now. So, guys, this is the book I was talking about. This is the PDF file that I was able to pull out. I tried to search for some more. I'll try to find as much material as I can so that it will help you. But yes, try to devote time and do random researches. You want to know more about this, more about US healthcare. So try to take an overview and understand this. I will cover everything, but still, just go through this. And if there is any doubt, any query, come to me. I'll try to find out more material and put it on the online classes as well. So this is the book I was talking about. Let's start. Let's begin. So this is the ICD 10 CM book for diagnoses. So there are so many codes you can see. Can you see from 1 to 21? Yes. So these are the different categories of codes. For example, the first chapter from A00 to B99 is the codes for infectious disease, for parasitic disease. So the our this what do you think our COVID comes in? Our COVID code. What is COVID? COVID is an infectious disease or what? Guys, random. Any guesses? Respiratory. But what exactly is it? Respiratory is the manifestations. It affects the respiratory system. Yes, it is an infectious disease. So COVID is basically a virus, a viral. So it comes, right, guys? Yes, yes, yes. Respiratory manifestation. So these are the different classifications depending upon the diseases. For example, first cover certain infectious and parasitic disease, neoplasm under this series, disease of blood forming areas, this series. Our COVID code is, I guess, U07.1, I guess. So that's a new code that's being launched in June only. Endocrine codes are this diabetes codes come under the endocrine disease. So it's in this E series. So these are different series of codes depending upon the system involved. Is it a disease of digestive system? Is it a disease of respiratory system? Is it a disease of circulatory system? Okay. So this is the book looks like. Let me just scroll it down for you. For skin, we have a different series. People who are asking what should we do, just pull this book out and just take a feel of this. I'm not saying It is impossible to mug and to learn all the codes. Even the person with 20 years of experience, I might remember some codes like E785 for hyperlipidemia, I10 for hypertension. So many codes I learn out, but you cannot remember all codes. But you should have a fair knowledge about what are the systems, how code systems are there. So people who are asking what should we do, for example, today you just pull out this and just read. Okay, there are different disease code for nervous system. There are different series for eye, for ear, for circulatory, respiratory, digestive, skin. Okay. Then there are symptom codes. The symptom code starts from R series. You need not to learn anything. Just take a feel and just try to, understand things. These are the guidelines I was talking about. Initially, what is exclude one? These are the guidelines. These are very detailed thing that even the experienced coders, they need to revisit, they need to again read the guidelines, what exactly that guideline says. So these are the guidelines. Chapter 1, infectious disease. This is a detailed infectious disease code. I will like in the upcoming sessions, I will let you know how we find out a code, how we search out for some code. But I just wanted to show you the book, how detailed it is. Cancer codes we have, drug codes, alcohol dependence, so many codes. Let me show you the diabetes. How many varieties of codes in diabetes? See this. These are the varieties. Now you need to figure out how to code, how to find out the specificity from the record first, and then how to code. Guys, any other question? You're unable to see the book? Guys, are you able to see the book? Um, Hiranya, I'm not sure. I'm taking your nickname, might be. I'm not sure why you're not able to see the book. I guess everyone is able to see the book because I have, yes, yes, because I have shared it. Not a problem with that. I will try and give a link maybe, or maybe upload somewhere. I'll ask Vibha how to do it and I'll upload it online so that you guys can access it, can see it. Not a problem with that. It's just the start. Book should be handy with you. You should read about it and you'll find it on internet as well. So it's okay. Any other question, guys? It is just the start, so don't worry about it. Link will be helpful. So I'll do that. I'll upload this. I'll try and upload this online and I'll give you the link as well. Where will you share the link? I'll let you know. Uh, I'll let you know soon. Any other question, guys? That's all from my side. No, Gunjan. I will upload. I will give you the link or the PDF file. I will ask Vibha or other people managing this, and I'll upload this. Don't worry about it. I'll give you the PDF file link. Okay, guys. I think no other questions. Thank you so much, Gunjan. So thanks a lot, guys, for joining in. I hope I'll try to make the other sessions more interactive, more interesting, and let me know how can I, any feedback or whatever you want me to simplify this. I'll try my best. And let's meet in the next session. Most probably it will be on the next Sunday, but I'll update you. We'll update you guys. Don't worry about the next session. Most probably on next Sunday. Thanks, Gautam. Will you update prior? Yes, yes. I'll give you update maybe in 2 3 days only. In a day or two, we'll let you know.